Dr. Powell Coley joining us now to talk a little bit about colorectal cancer awareness. Let's talk about screening because I think David almost lucked into screening, didn't he?
He did, and Tom, all too often we hear stories like David because colorectal cancer is predicted to become the #1 killer in people under the age of 50 in just a few years. And so we're seeing more and more of these Gen Z and millennials, for reasons that we don't completely understand, being diagnosed with colorectal cancer. In fact, you're 2 to 4 times as likely to get colorectal cancer if you're born after 1990 as compared to being born in 1950. So the fact that we've lowered the screening age to 45, which is a recent development, I think saved David's life here. Mm-hmm. And I really want to spread that message that many of us walking around living our lives feeling good, if we turn 45, we have to get into that doctor's office as soon as possible.
Don't wait for a cue or a clue or a signal. If you're 45, even if you don't have the history that he had genetically, you should be tested?
That's exactly right, and some even earlier. So if you've had a family history, you go down to 40 or 10 years before your family member actually got it. And some high-risk groups like African Americans may also want to talk to their doctors because oftentimes, think about our colon. It's an organ that holds our stool, right? So it's a hollow organ. So if there's a tumor growing in there, it's not going to declare itself until it gets really big or starts to interfere with structures, and then you could have abdominal pain, bloating, change in bowel habits, you could have blood in your stool, but it takes it to get far along, and the difference between an early cancer and a far along cancer is literally life and death.
Well, David, that's your story. I mean, you think of how close you were, the timing between when you found out and what might have been happening in your body even a month or so later was significant.
It was really significant. I mean, it brings chills to my arm, and I couldn't have been more lucky to have it happen when it did and to be discovering it. The thing I'll say about what Dr. Coley was talking about is that I think in our society we get scared of colonoscopies for some reason.
Sure.
In my experience, it was a nap and you wake up and they ask you if you want juice, right? And it can be preventative, right? You can take out polyps that could turn into cancer. So there's no reason not to go.
Well, we talk about the aspect of business in healthcare. Is there a problem there as far as insurance? But anyone who has insurance at 45 is eligible.
It's covered. In fact, even those without insurance, arguably because it's a preventive treatment, should have that option available to them. And it used to be an old man's disease, and now it's a young person's disease. And to your point, colonoscopies are not scary, they're easy. The hardest part is just that prep you have to do the night before, where you have to clean out your colon, but then you get to eat whatever you want the next day after you wake up.
As we just talked about, it's not gender specific. Men, women, it's the same.
It's not, and it can affect certain races more aggressively. So African Americans are more likely to get it. They're more likely to die from it. But really, it's not gender specific. Men and women can get it. Now, there's certain habits that can increase your risk: eating more red meat, drinking more alcohol, having obesity, having a sedentary lifestyle. These are all risk factors associated with an increased risk of cancer, which many of us, I think, nowadays do have those types of risk factors with processed food and such. But you get in there, you get it taken out, that could be potentially curable. And in David's case, they followed it with chemotherapy because they wanted to make sure all the microscopic cells were really gone.
Correct.
Well, we always love visiting with you, but it's great to see you, especially knowing what you've been through over the past year. But it's nice to see you healthy and get back to work. We're done with you. Back to promotions. You can get more with Dr. Coley, of course, at 9news.com/Dr. Coley. Thanks.